I think one of the biggest things to keep in mind when we talk about point of care ultrasound are its limitations. I think that is one of what I have seen in practice, one of the pain points that we run into, even just from the client perspective of making sure that we explain the difference between the ultrasound capabilities that we have in our office and the ultrasounds that may be done by a specialist or a radiologist. I think that's one of the biggest things to keep in mind when we introduce point of care ultrasound into our clinic is how are we going to have that messaging and frame that messaging. This article was interesting. I think one of the statistics was that 53% of vet practices have an ultrasound machine in their clinic, which I felt like we're kind of at a really unique point where it's just as common as it is uncommon to have these in practice. So I think as these become more of a standard, now is a great time to kind of have that dialogue across the profession as far as what role are these playing for our patients.